Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
This is Dr. Candace Pierce with Elite Learning by Calibri Healthcare, and you are listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. In this series, we will be discussing some innovations in diabetes mellitus management. And for this episode, we're going to really focus on some of the latest innovations in diabetes management. Now, in recent years, we've witnessed a remarkable surge in technology really aimed at revolutionizing how individuals with diabetes monitor their blood sugar levels and even administer insulin. From wearable devices to continuous glucose monitoring systems and advanced insulin pumps, there are some really cutting-edge solutions that are improving quality of life and empowering better self-care. Today, we're joined by Dr. Patrick Welch, an advanced clinical pharmacist, where his current practice includes chronic disease management. But you're heavily focused on diabetes management, is that correct?
Yeah, that's right. So I'm in family practice, but most of my patients have diabetes, as there's a large need for access to diabetes care, and so that's where most of my time is spent.
Oh, great. Thank you so much for taking time to join us for this discussion.
Yeah, you're welcome. Thanks for having me on. I'm excited to talk through the technologies and advancements that we have.
Absolutely. How did you get started in this area of medicine?
Yeah, good question. And when through pharmacy school, putting a pharmacist in clinics was starting to become more and more common. And where most of those pharmacists got in is through diabetes management. And so in school, that's kind of where it started, where I started learning more and more about diabetes and had opportunities to volunteer at different clinics where a lot of that focus was on diabetes management. And then through residency and jumping into my practice, again, that need was just huge. And so that's where I jumped in. Through my residency, we didn't have a whole lot of access to endocrinology support for patients. And so everything was kind of dumped on the pharmacy team. And it's where I learned most about continuous glucose monitors and really insulin pumps and diving into that and making sure patients have access to the technologies that are available.
Absolutely. That's really good. I know they just started putting them in, a lot of different units in the hospitals as well. So really I see the pharmacy profession as really being able to specialize more in different areas.
Yeah, absolutely. And as a pharmacist, we're always known as probably the most accessible healthcare provider, right? You think your local retail pharmacy, where there's always a pharmacist there. And the hope is as people gain that trust in their pharmacist and as these technologies get more and more simple, there's a lot more access of these technologies at the pharmacy as well. And so I think patients are going to be relying on pharmacists and our nurse colleagues, even support staff like MAs, to really help understand a little bit more about how this technology can help in their healthcare journey.
It's really great to see how healthcare providers are becoming more accessible to patients, especially when it comes to chronic disease management.
Yeah, absolutely.
So to get us back on track, can you kind of give us an overview of the latest wearable devices and continuous glucose monitoring systems available for diabetes management?
Yeah, there's a lot more that have come out. As I started into this journey, there were just a few that were available, and they've gotten better and better through the years. So I'll start just kind of how these technologies work and what they are. There's three main pieces when we talk about a continuous glucose monitor. There's a sensor that's implanted or somewhere underneath the skin that's gathering that glucose data. There's also a transmitter. That transmitter is what gets information from the sensor and then transmits it out to the third piece, which is a monitor, or now more often a smartphone app where the user can actually see those readings. So those are the three main components of these devices. Now, the ones that are available on the market, there's a few different ones. There's some what we call real-time continuous glucose monitors, where they're constantly giving that transmitter is constantly transmitting that data to the receiver or that smartphone app. There's some intermittent scanned continuous glucose monitors where that requires the user scans their monitor over the sensor to gather that data and see those readings. There's also an implantable one that's a little more long-term that requires a physician go in and implant a little sensor underneath the skin, and then that transmitter is removable and sits on top of the skin. So there's different ones that are now available. I think the good thing with it is, again, there's more and more competition in this field, which is leading to more innovation, improvements as these companies are going against each other. And so there's a lot more access, even over the last couple years, of patients really being able to get to these devices as those companies have been improving not only the functions of these devices, but as well as access and cost a little bit as well. So now the main ones that are on the market, we're getting some pretty good access to them as well. So Dexcom, Libre, Medtronic has a standalone CGM, and then Eversense are the four main ones that are available on the market. In the primary care setting, and those that are in primary care, most, I would assume, are familiar with Freestyle Libre devices and the Dexcom devices, as those are what are out now. And in essence, they're all similar as far as how they're working, how they're getting the information, and what they're reporting that to. There's a few nuances between the different devices that might fit one patient better than the other, depending on patient specifics. But yeah, there's a good amount now on the market, and they're becoming more and more accessible. And as we go through our discussion today, I hope that those in primary care are going to understand the benefits of using these in their patients, as well as just the improved access and ease of getting these set up and running.
Right. So you talked a little bit about the different pieces and components that make up the wearable devices. So what about some of the technologies inside of them? What are their key advantages?
Yeah, if we look at advantages and why we're using this versus standard of care, or what we considered standard of care in the past with just a glucometer, a finger poke, these are giving us that real-time data of what's going on. It's helping not only the patient understand what's impacting their glucose, but from a clinician standpoint, it's a whole lot better seeing a data point every minute or every 5 minutes compared to that glucose log that they'll bring in with 2 or 3 finger pokes throughout the day, and we're guessing what's going on between those. So one of the biggest advantages as we look at that from kind of where diabetes care has evolved is I can have a patient that comes in that has a fasting glucose log that looks very well controlled. We've got maybe 100, 110 on their blood glucose readings, and maybe they've got some postprandial readings that are good, but that's all the data I have. If I compare that to a CGM and the data I get from that, maybe that fasting glucose is very well controlled, but there's data points of overnight, maybe they're having undetected hypoglycemic events that were going undetected. And so that can help us improve that patient safety. Or maybe they're getting some additional spikes in between those either pre-meal readings they're getting or postprandial readings that they were just unable to see. And so that allows us as clinicians to really focus on medications, more targeted education with these patients, as well as the patients are going to start learning what's impacting that glucose, what's causing those sugars to go high or go low, and help them start to make a few little changes in their day-to-day routine that's going to help improve that. So from a technology standpoint and the advantages of it, it gives us that safety net of those lows, those undetected lows, as well as just giving us data, giving us that knowledge we need and the patient needs to make better decisions and improve what we're doing and the goals of therapy and the therapeutic plan that we have for those patients.
Absolutely. So a question for you is accuracy of these particular devices. I've seen where maybe they're reading low on the continuous glucose monitoring device that they're using, but so they'll do, a finger stick. Let's just go ahead and check and make sure, is it actually reading correctly? Or high, is it reading correctly? What is the accuracy rate of these?
Yeah, I love this question because this is something I deal with on a daily basis in clinic, where I get patients that are obviously concerned, right? They do that, what you just explained. Their CGM is different than their finger stick, and they're wondering, can I really trust this? Is this even a beneficial device for me. So I'll start with how these devices are approved through the FDA and what that looks like. There's a couple different parameters that are looked at. So there's one that's called the MARD, or the mean absolute relative difference. And that's just looking at the difference between actual glucose levels or blood sugar levels and the CGM values. The lower the number, the more accurate the CGM readings are. Most on the market have kind of set a precedence of 10% or lower. If that MARD is 10% or lower, it's likely fairly accurate. Now, understanding that, there's still going to be some variability between actual glucose and these readings. The other thing they'll look at is what's often referred to as a 20 over 20% or a 15 over 15% rule. And that's if the glucose is at 100 or below, that reading on the CGM has to be within 20 points of the actual glucose reading. If their glucose is above 100, then the CGM reading needs to be within 20% of that. So I'll often explain this to my patients where, 20, if your sugar is low, that CGM is probably going to be pretty accurate, right? Even if your glucose reading from a finger stick says 60 and the CGM says 55, that's not a difference to me, right? That's accurate. The higher the sugar, if our sugars are uncontrolled and sitting at 300, then we have a 20% variance on either side of that 300. And so there's a lot more possibility that your finger stick might show 260 and your actual CGM reading is showing 300 or so. But that's that 20% fluctuation that's allowed. Now, it's also important to point out that our glucometers aren't 100% accurate as well, right? There's a lot of variations or variabilities from device to device with the glucometers. And so there's can be hey, is my CGM accurate? Is my glucometer more accurate? What I look at when I have patients come in, we'll check the A1C and I'll pull their 90-day history from these CGMs, and I'll look at the average glucose, the expected A1C from these monitors, and compare that to the A1C that I get. And there's a few outliers, but almost always our CGMs are showing within 0.1 or 0.2% of the actual A1C that I get. And so I like to explain the trends that we see with these devices are fantastic. The ability for the patients to, again, see that trend of, hey, that blood sugar is spiking. What did I do that caused that? That's really what I want these patients to focus on as they wear these. And obviously there will be some outliers that for whatever reason, they just have less than accurate numbers with these CGMs, but for the general population, I'm pretty confident in these CGM readings. And I like to help our patients understand, all right, let's look at the trends. If alarm goes off, let me think, am I symptomatic because it's a low alert? And if I'm not, then let me check with a finger stick. But other than that, these devices have evolved so much that I don't have many concerns at all with the accuracy of them.
That's really good to know. That's really good. From a patient's perspective, using these particular devices, can you share some examples of how it's really enhanced quality of life for patients?
Yeah, I have a lot, especially my more elderly patients that I think are a little bit hesitant to try any new technology or just
Yes.
scared, right? They're like, I have a smartphone, but I don't even know how to answer it. How am I going to use one of these? From a quality of life for patients, that's usually a hurdle to get over. And I would say if I have 100 patients, this is just my anecdotal evidence from practice, but if I have 100 patients, I probably have 2 that stop CGM therapy and the rest continue it because they love it. So it gives them that advantage. In fact, I had a patient just last week where he came in just on some basal insulin therapy, uncontrolled, gave him 2 weeks on a CGM. He came back in and his first comment to me when I walked in the room was, why did I not start this earlier? This has been fantastic.
That's
And
great.
it's just awesome to see you give them that data and they are going to make a whole lot of more improvement than if we're just giving them one finger stick a day on long-acting insulin, right? And so that patient specifically, we were able to look through the data, gave us the ability to have more discussion on what lifestyles like, what diet has been doing to those sugars, as well as open the door for more education on medication and further discussing the plan for either adding GLP-1 or some mealtime insulin, which is what we did in that case. So that's a good experience of these patients. Although a lot are hesitant to start on them, they end up loving them. A couple other really good things I've seen is adding to that safety net. I've had multiple patients, or specifically multiple caregivers for patients, that are concerned all night long of lows that have been happening. They've had,
Oh,
horror stories
yeah.
of lows, and they've just had bad experiences, and so they're concerned. They wake up multiple times to check on the patient as the caregiver, and giving these, it's really allowed them to sleep throughout the night. They confident in, hey, I'm not going to need to wake up and check unless I hear that alarm go off. And that's, I think, been a very big benefit that I've seen in a lot of patients and family members' lives. And there's, as we talk about quality of life, there's lots of studies that show an improvement in that quality of life. In fact, there's one, it was from 2017, I believe. It was posted in JAMA, but it was, I mean, that's a while back when we were talking about technology. And so this was some of the earlier CGMs that were less user friendly, a lot more cumbersome to put on, required finger
Right.
sticks. But even those studies showed improvement in treatment satisfaction, less hypoglycemic fears. And so from then, it's only improved as far as ease of use. And I've seen that patient satisfaction really go up, and just been life changing for a lot of patients by just giving them the data so they are more aware of what's going on.
So, kind of going back to the word hesitancy, because to a lot of patients, this is newer. Electronics are newer for them. They're trying to understand how to use them. This is how I've always done it. This is what I know. This is what's been around the longest. So, if you're a healthcare professional and you are in that place where you have a patient that is just very hesitant, what is your advice as far as, how do you help them become more comfortable with technology, become more comfortable with their abilities, and even the safety of these particular devices?
Yeah, that's one of the biggest things I use are just the demo devices. I think giving is, as I talk with patients about this, or the possibility of getting on, whether it's an insulin pump or a continuous glucose monitor, as I talk about it, I think I can sense that hesitation because they're unfamiliar with the devices. And so leveraging the demo devices that we have, or reach out to your local reps from whatever company and get those demo devices, because that's been very beneficial. Where all the time patients are telling me, oh, that's it, that's all, I was expecting something very large, or a large needle. And so I'll show them those demo devices first, and that kind of helps them understand, okay, this is something that's a little bit easier. The other hesitation with the technology piece is, as I tell them, hey, this is going to, report to your smartphone, or we can hook it up to your phone. That's where, especially the elderly population, get very more shy of smartphone. Hold on, I can't do that. And so I'll show them the monitors, and the monitors, I like to tell them it's very similar to their glucometer, right? They've been going years with finger pokes, and they can manage that glucometer. The reader is even easier. All they have to do is push the button to wake it up, and those glucose numbers are going to be right there. And so I'll show them those devices, walk through some of that. And those that are more hesitant, instead of pulling the trigger and saying, I'm going to send in this prescription, we'll leverage samples that are available to clinics, where I'll throw on a sample from one of the CGMs, let them wear that for a couple weeks. And again, that's where I found that once we have a conversation and show them these devices, they become a lot more open to wearing them, because they start seeing that benefit even within a day or two of putting it on.
So when they're using these devices, is it recommended that they have a separate smartphone, or is it okay to put it on their cell phone that they use every day?
Yeah, great question. So with the receiver versus, or the monitor versus a smartphone, the smartphone, or having it hooked up to a smartphone, gives us some advantages. Where one, we can share that data remotely with our clinic. Every CGM company has their own platform, their own cloud, where they're collecting that data. As a healthcare provider, you can log in and see that data. So that gives us an advantage, where remotely we can see that. So if I have a patient that calls me and says, hey, I'm having low blood sugars, I can quickly pull that up, see what's going on, and make some adjustments. The other benefit with using that smartphone app is they can allow family members to get those readings as well, which allows those family members to be alerted for low blood sugars or high blood sugars. And again, that peace of mind for caregivers or family members, especially for elderly patients, they can constantly track that. So I don't ever recommend getting a new phone for it, but most of the time we can hook it up to the current smartphone that they have. And if that's not an option, or my patients that don't have smartphones or say they never carry it with them, then oftentimes we'll just go to the monitor and let them use the monitor. We can't get the remote data from that, but every time they come in to the clinic, plug in that and you get the full set of data, or they can upload it at home by plugging it into the computer as well. So some advantages to using a smartphone, but for the most part, most patients' phones now are compatible with these devices, and they can just use the current phones that they have.
Privacy. A lot of people are like, whoa, wait a second, this is saving my data. What do they have for privacy?
Yeah, good question. These devices, and the two most common ones that I use in practice are Freestyle and Dexcom. There's those patient agreements that they go through as they set up the app. There's also on the back end and on our side, these companies do take that protected health information seriously, and so there's safety nets that they have. There's a provider login that allows the provider to manage those that have access to that. There's codes that we have to share with the patient so they can put that code in, and then they click, yes, I do want to share this with my healthcare provider. So there are some protections to protect that data. But that's still a real concern for a lot of patients. I get a lot that are concerned with that data sharing, that privacy. And if they're concerned, a lot of those, again, I just have them give them the reader, let them use the reader. That's not uploading anywhere. They come into clinic, we just pull the data from that to see what's going on, and that's a way around that. I've got a couple other patients that will come in, they use their smartphone, they don't share anything until they're there in front of me. They'll click share, we can grab the data, and then they unshare so that they're not freely sharing that data again. And so there's a few ways around it, but that is a hesitation. And in those instances, I think using the monitor is a good way to address some of those concerns that patients might have.
So we talked quite a bit about the continuous glucose monitoring, but there's also technologies that help with the insulin delivery and really optimizing the dosage that patients get. Can you kind of walk us through the advancements in the insulin pump technology?
Yeah, this is where I'm really excited, especially in the area of primary care. I think historically we've always thought, hey, it's an insulin pump. Yeah, you might be a good candidate, but I can't do that here in primary care. We have to send you off to endocrine. Endocrine is very busy. I think there's a lot of shortage of endocrinologists throughout the country, which means patients are having more barriers to access these insulin pumps. And so over the next several years, I see this expanding a lot in primary care, where hopefully our clinicians are going to be more comfortable and confident in managing these, because it's not that difficult. It's just a piece of technology like these continuous glucose monitors of once you see it, once you learn a little bit about it, I think you're going to be pretty confident in using it. These pumps, as we tie them with the CGMs, it allows us to have a closed loop system where the continuous glucose monitor is feeding data right to the pump, and that pump is making decisions based on readings that it gets from that continuous glucose monitor. So we're past the point of just standalone insulin pump where the patients are having to put in all sorts of data throughout the day, whether they're carbs, glucose information, and these pumps are kind of doing that on their own. So it's been a game changer. It's helped a lot of patients improve A1C, as well as, again, the safety benefit of it, of a reduction in hypoglycemia. I had a patient not too long ago that was had type 1 diabetes, over the age of 65, had diabetes for 30 plus years. His spouse had told me, every night I wake up, check on those sugars. They're always low. Goes through 2 to 3 glucagon pens a week because of these lows that he was having. Had never been on an insulin pump. Again, that technology fair, we talked through it, got him on an insulin pump, not having lows throughout the night. again, they're able to sleep, doing so much better, not having to use that glucagon almost ever now. And so it, again, as we talk about technologies and how it improves the quality of life, it can be such a game changer. And so allowing access to that in the primary care setting is huge. And in my practice, I don't have all the resources that our diabetes clinics might have or endocrinology clinics. And so I leverage the educators of the insulin pump companies to come in and help teach my patients the technology and get them set up and running on these pumps. And that's I think an easy way in the primary care setting for our clinicians to not spend any more time with these patients, but still give them the ability to have access to those insulin pumps.
So, what about accuracy versus, malfunctioning of these pumps?
Yeah, malfunctioning is probably the biggest concern when it comes to those pumps, right? There's a lot that goes on.
Right.
Is the infusion set up correctly? Did I put the insulin in the reservoir correctly? Is there something on my pump that I touched that paused the setting or anything like that? So part of my process in setting these up is again, most of the time we leverage those educators, but we'll go through, all right, this is what we do if your readings go up. Let's check a couple things. Let's check your site. Let's make sure there's insulin in the pump. Let's make sure your pump battery is not dead. Let's make sure that pump is on. I'll also give them the pump company information, because these pump companies have 24-hour support lines where they can call them. But we'll go through, all right, you've got a long-acting insulin prescription. Make sure you've got a basal insulin in the fridge. That way, if your pump fails, you've got some insulin, you can go back to injections. And making sure we have that conversation with these patients has been huge, because I do get patients that go into the emergency department for an issue, hyperglycemia, and providers inpatient in the hospital, I don't think have a lot of confidence or knowledge on these pumps. And so most of the time I see them just telling them to take their pump off and saying, go back to injections. But that's all the information they get from that provider is just go back to injections. They get no more instructions. And so making sure we write down for the patients, this is what you do if these pumps fail. And again, I don't have a whole lot of issues with pump failure or patients being unable to manage a pump issue, because we've gone through that education. They're comfortable on these pumps, and again, they're getting very, very easy to use and troubleshoot if issues come up with that. So it's definitely a little bit of a learning curve, but from a primary care standpoint and improving access to these, I don't see any reason we shouldn't be having these discussions with patients in the primary care setting.
Absolutely. And I do see where there is a gap of education of healthcare providers from the clinic setting to the hospital setting, just working as a nurse at the bedside and being told, we're not going to mess with their insulin pumps. We don't know anything about those. We go right back to using sliding scale insulin and finger sticks, to check the blood sugar. So instead of being able to leverage the things that they already have in place and be able to send them home understanding what to do when they get home. Well, we can't tell you what to do when you get home now, because we've had you on finger sticks and sliding scale, and now I don't know how to get you back to where you were in your normal day-to-day routine. So we definitely need more education and guidance in between, our primary care versus our emergency care versus our long-term in the hospital care, not necessarily long-term facilities. I'm not sure. I can't speak on, how those work, but definite gaps there in education for us.
Yeah, absolutely. And one thing I've found is I've worked with patients on insulin pumps is these patients almost always know this pump better than I do, right? They're living with it 24/7. And so when they come in, I'll ask them, hey, what's going well? What are you seeing? What issues do you have? And most of the time I'm learning something new about that pump every time, because I'm not the one spending every single second with it. And same thing on the inpatient side. If we can, I think as a clinician or an aide or a nurse on the inpatient side, if we just say, all right, what are you doing at home? Maybe, the hospital protocol still has, you've got to come off your pump. We've got to do Q4 finger sticks. But still, if we can just get a sense of what the patients are doing, because they live with diabetes every day and they know how to manage that. I think that goes a long way in having those conversations with the patient and understanding and giving them the credit of, you probably know more about what's going on with your diabetes than I do as the provider.
Absolutely. And it's going to start with educating of those clinicians that are inpatient, and then working through policies and procedures of hospitals that allow those at the bedside to be able to, utilize the tools that this patient who comes in, who has had diabetes for, a really long time, they know what to do. Let's leverage that so that we can make sure they get the best care.
Yeah, absolutely. And I think we will see more and more protocols and health systems change where more and more patients are able to use, whether it be the CGM or their insulin pump while inpatient, because they're becoming more and more accessible and more widely available.
Absolutely. Well, Patrick, we are at the end of our time for episode 1, but we're going to be continuing this discussion in episode 2, where we're really going to kind of focus on the future of these innovations and maybe some emerging trends and the potential for further integration of artificial intelligence and personalized medicine. So, and if time allows, hopefully we can get into the challenges and considerations surrounding accessibility, affordability, and that widespread adoption of these really great cutting edge solutions. So we hope you'll join us for episode 2.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.